patient, a rugby player, with a previous injury of the distal biceps tendon. After surgery, the tendon was reattached into the radius, and our patient developed insufficiency of the radial function. Specifically, if we ask our patient to extend the wrist, we see a limited extension and no extension at all for the fingers. So we see two surgical scars here related to previous surgery, and now we place the probe. Give me some gel, please. Over the distal biceps. So that's the image. This is lateral, this is medial. This is the long head, this is the short head of the biceps. Of course, we have to check the status of the lateral cutaneous nerve of the forearm, the distal branch of the musculocutaneous nerve, and this nerve appears normal. There is no focal swelling of the nerve close to the tendon, but we see an unusual feature here. So the short head of the biceps was redirected laterally. It passes underneath the long head, and then following it down, we see the thickened tendon going here to insert into the radius. We can see some sutures and some bone irregularities related to the position of the anchor, and this is the long axis view showing the heterogeneous tissue and thickened tendon insertion. So when we check the radial nerve, we identify the radial nerve here in between the brachioradialis and the lateral edge of the brachialis muscle, and we see the radial nerve made of two groups of fascicles. The lateral one is the origin of the posterior interossous, the medial one is the sensory branch. Following the posterior interossous nerve, this is the posterior interossous, we see that this nerve passes underneath the short head here, redirected laterally. Then it curves around the short head. It becomes superficial again, and then it moves down to reach the level of the arcade of Froese, and finally it enters the supinator tunnel. How is the posterior interossous nerve within the supinator? I see thickened fascicles here. This is the level of the arcade. The nerve appears swollen, and then when I pronate, I can follow the posterior interossous nerve distally. I see the fascicles remain very thickened here, and finally they exit the tunnel and they return to their normal size and caliber. So from distal going to proximal, I see the thickened posterior interossous nerve across the full extension of the supinator. That's the nerve, and the nerve is here close to the redirected short head. Then you see that the nerve forms a loop around the short head, and finally it joins the fascicles of the superficial branch to form the main trunk. This was a scan from distal to proximal. So this is a case of a stretching injury of the posterior interossous nerve related to the redirected short head of the distal biceps tendon. How is the long head? The long head was normal. It appears absolutely normal. When I change the position to check the long head at the level of its insertion, I can recognize the tendon distally. So this is the artery, and that is the long head. The long head looks completely normal. This was unaffected. Probably before surgery, the injury was an incomplete tear affecting only the short head, whereas the long head was spared. So this is a case of complicated surgery for the distal biceps tendon, in which the radial nerve underwent a stretching injury.